29-year-old woman presents with severe urticaria and angioedema 12 days post Moderna mRNA COVID-19 vaccine. Labs show normal complement levels and negative autoimmune markers. What is the next best step? Somebody had a COVID vaccine 12 days ago. Now the patient has developed severe urticaria and angioedema. Normal complement levels, negative autoimmune markers. What's the next best step? Urticaria, angioedema, 12 days. What's the next best step? Negative complement levels, negative autoimmune markers. What's the next best step? Next best step would be to give high dose antihistamine. So that would be C. So Dr. Gideon was right. C. So we learned again that you are not going to do skin biopsy unless the patient presents with signs of vasculitis. And corticosteroids are not the first line, right? Corticosteroids are not the first line. You want to give antihistamines first. Okay. Can somebody read this case for us, please?
A 35-year-old woman experiences bloating, flatulence, and abdominal cramps after consuming dairy products. Which of the following is the most likely diagnosis? Option A, IgA-mediated milk allergy. B, lactose intolerance. C, celiac disease. D, fructose malabsorption.
So many people are going for B. It looks like this one is very simple and straightforward to the point.
Yes.
Yeah, looks like B. So that is lactose intolerance. So lactose intolerance is a common condition resulting from deficiency of lactase, the enzyme necessary to digest lactose found in dairy products. Okay. Symptoms of lactose intolerance can be bloating, flatulence, abdominal cramps after consuming dairy, which are classic features of lactose intolerance. And why is it not celiac disease? We've already talked about that. Why is it not fructose malabsorption? This condition will usually present with gastrointestinal symptoms after consuming fructose, not lactose, right? So this patient is consuming lactose, and that is why the patient is having the symptoms they are having. Okay, can someone read this case for us as well, please?
A 32-year-old man with a known allergy to birch pollen experiences itching of the lips and mouth after eating fresh apples and carrots. He has no symptoms when these foods are cooked. What is the most appropriate management strategy?
Exactly.
A, avoidance of all forms of apples and carrots. B, referral to an allergist for desensitization. C, advising the patient to eat only cooked forms of these foods. D, prescription of an epinephrine auto-injector.
Is it A? Is it B? Is it C? Is it D? Is it E? Is it C? Or D? Good. So it looks like people are getting the concept. So the correct answer is to advise the patient to eat only cooked forms of these foods. You know, this patient likely has, and we've learned this concept already, but we are using it to answer something different. This patient likely has oral allergy syndrome, which is characterized by itching and mild swelling of the mouth after eating raw fruits and vegetables. Therefore, oral allergy syndrome, how do we prevent it? Cooking the foods denatures the proteins responsible for the symptoms and therefore makes them safe to eat. So what's the next best step if you diagnose that somebody has oral allergy syndrome? You encourage them that the fruits and the vegetables they eat, at least they can cook them. If they cook them, that is what is going to help them. Okay, so I'm going to read this case for you. A 24-year-old male presents with paroxysms of sneezing, rhinorrhea, nasal obstruction, and itching of the eyes, nose, and palate. He also reports experiencing fatigue and irritability. His symptoms are worse in the spring and improve during the winter months. Based on his presentation, what's the most likely diagnosis? A, acute sinusitis. B, non-allergic rhinitis. C, allergic rhinitis. D, chronic rhinosinusitis. And E, atrophic rhinitis. The answer is allergic rhinitis, obviously, which is C. Looks like a lot of people went for C. So the patient's symptoms are characteristic of allergic rhinitis, which includes sneezing, rhinorrhea, nasal obstruction, and itching of the eyes, nose, and palate. So you've got to also know how patients with allergic rhinitis present, how patients with allergic rhinitis differ from patients with acute sinusitis. Those acute sinusitis, they usually present with purulent nasal discharge, facial pain, and facial congestion. And those with non-allergic rhinitis, there's lack of itching and seasonal variations seen in allergic rhinitis, right? So that's the difference there. I need a volunteer to read this case for us, please. Who read a case for us, please?
Okay.
Okay. A 16-year-old male with a history of seasonal allergic rhinitis presents with fatigue, poor concentration, and difficulty sleeping due to nasal congestion. Which complication of untreated allergic rhinitis is most likely contributing to his symptoms? Option A, Eustachian tube dysfunction. B, sleep-disrupted breathing. C, chronic sinusitis. D, oral allergy syndrome. And E is anosmia.
So what's your answer? Is it A? Is it B? Is it C? Is it D? Is it E? A lot of people are going with A. Others are going with B. I don't know why somebody would go with A, by the way. The answer is B, sleep disturbed breathing. So what is sleep disturbed breathing? Sleep disturbed breathing is a significant consequence or sequelae of untreated allergic rhinitis. Okay, the patient has untreated allergic rhinitis and it is not treated, leading to fatigue and poor concentration. So what about eustachian tube dysfunction? Can cause ear-related symptoms, but not directly linked to poor concentration and fatigue. What's your main issue here? It is poor concentration, difficulty sleeping, fatigue. That's what sets the things apart. Anosmia is loss of smell and can occur, but does not explain the fatigue, right? Loss of smell is loss of smell. It does not explain the fatigue part. And oral allergy syndrome involves oral itching and swelling, not sleep disturbances, okay? So what is the correct answer? The correct answer is sleep disturbed breathing. That's it. Okay, next question, please. Next question, doctors.
A 7-year-old boy with a known peanut allergy presents to the emergency department with wheezing, coughing, and vomiting after arriving home from school. His mother reports he was well in the morning and received no calls from his teacher during the day. On examination, he is flushed and has scattered urticaria on his neck and his axilla. Further questioning reveals that he shared a candy bar on the bus ride home. Which of the following is the most likely diagnosis? A, asthma exacerbation. B, acute urticaria. C, anaphylaxis. D, acute gastroenteritis.
Peanut allergy known. Emergency department, wheezing, coughing, vomiting. It looks like he was well in school. And now he has urticaria on the neck and the axilla. He was well in school until he tasted someone's candy bar in the bus. What is your answer? Acute asthma exacerbation, acute urticaria, anaphylaxis, or acute gastroenteritis? Like a lot of doctors went with C, anaphylaxis, and that is correct. Okay, anaphylaxis is correct. The presence of wheezing, coughing, vomiting, flashing, and urticaria after ingestion of candy bar in the patient with known peanut allergy strongly suggests anaphylaxis. Why is it not asthma exacerbation? While wheezing and coughing could suggest an asthma exacerbation, the additional symptoms of flashing, urticaria, and vomiting make anaphylaxis more likely. So you just have to, when you see a case where, it looks like two things are presenting similarly, you have to look at the other symptoms and say, what is more likely in this and not likely in that? Next question, doctors, please, somebody read it for us.
A 20-year-old woman with a history of poorly controlled asthma presents to the emergency department with difficulty breathing, a sensation of throat swelling, and dizziness 30 minutes after eating a seafood dish at a restaurant. Which of the following action is the most appropriate initial management? A, administration of antihistamines. B, administration of corticosteroids. C, administration of epinephrine. And D, observation and supportive care.
What's going to be our answer? The answer is C, administration of epinephrine, okay? So we've talked about it. We've learned the indications for IM epinephrine, the indications for IV epinephrine.